Hello, can you hear me?
Yes, it's clear.
Yes. Thank you.
I think thank you very much for you waiting for a moment because Dr. Ian Norton already done with the presentation. Okay, Dr. Rodrigo, maybe you will start your presentation.
No, before that, let me, Rodrigo, 1 second. Before that, let me introduce you with the participants. Dr. Rodrigo Offering is our regional advisor and regional coordinator who has a long experience in the emergency and humanitarian actions for our region, and recently he was mobilized in Typhoon Haiyan, and his support was quite significant. And today he is going to make presentation on the experience of Typhoon Haiyan as well as the regional perspective for the FMT. As part of the process, Rodrigo, when you want to do the slide transition, just tell next and Gade will do the slide transition. Now floor is yours and you are quite nicely audible to the participant. Thank you.
Okay, thank you, Nir. Salamat malam, and terima kasih Ibu Neni for organizing this orientation. Thank you also to colleagues in the WHO office. Shall we begin? So my presentation is about perspectives on foreign medical teams and this experience from Typhoon Haiyan, and also what have I seen in the past decade, countries in the region and also Indonesia. So first slide. Okay, I will begin with issues and needs. Okay, one is that the capacity to manage medical teams is not present in our ministries of health and it's not understood in our ministries of foreign. So there is a need for the MOH to understand this or have this capacity at national level and subnational. Two, there is a need for MOH to be open to be supported and develop this capacity. I think what happened in the Philippines during Typhoon Haiyan, the Ministry of Health was very open to us. We set up a system for registration of the foreign medical teams in GP. So there was a lot of work from the WHO side, but also at the Ministry of Health side and register all the foreign medical teams. At one point, there were about 116 foreign medical teams of the different types. Ian has already explained to you. Why do you need to manage foreign medical teams? It's not only to know who is doing what way or where is it up and where you can move people to answer a gap, but it's also to enforce certain national protocols for management of TB, of malaria, of different diseases. Otherwise, a big emergency can can be the cause for antimicrobial resistance or even poor quality of service to a patient. So in some cases, some emergencies I've been involved in, part of the preparedness is to disseminate the national systems. And here the foreign medical teams are your main audience. Next slide, please. Okay. So part of the needs is pre-registering. The registration process should happen before an emergency and pre-training of the foreign medical team itself. So that they understand what is the presence. One, that we are self-sufficient. Two, that they are working with the national government and national context. It is difficult to have foreign medical teams come and just do what they want and then leave without even handing over case reports or such a trade. Foreign advocacy should also be of the Ministry of Foreign Affairs department. Part of the registration and training and advocacy is telling them what good practice is. So first is introducing yourself to the Ministry of Health, to the Sub-National Ministry of Health for you, the regional crisis centers, before they start operating. Asking, where am I needed? Where should I set up my services? And of course, in the monitoring aspect, maintaining a certain standard. So, to operationalize these ideas, there are a few things that need to be done, and it should be integrated into a health emergency management program, such as what you have very well set up in Indonesia. So, before the event, there is a need for a health emergency management program to have policies on foreign medical teams and SOPs. They should be part of the whole process of organizing the response when foreign medical teams come to an emergency. During the response, there is need for the system to actually surge or scale up. So we will not expect all the foreign medical teams that come during emergencies do a pre-registration or do a pre-training. But what we need for an MPH or a Ministry of Foreign Affairs is that when the event happens, then we will have a system that you can put in place to be able to register and classify and track this foreign medical teams. That last part was where we were working around in terms of the Typhoon Haiyan in the Philippines. So I arrived on day 5. The system was already set up by day 3. So somehow it was already an issue of following up, filling up that registration system on a daily basis. In fact, during those first few days, the 3 hours you got new information both from your Ministry of Foreign Affairs or from the field of food and foreign. What is also important is what I saw in the Philippines was to have a decision maker. Someone was there deciding after the 60 foreign medical teams have come with an open-ended timeline. It is for the Ministry of Health, someone there as a decision maker saying, okay, we need to move this team to another island because in that island there is no medical service. There's no foreign medical team. One island, one city, and everyone. So there has to be this focal point at the decision maker that can deal with decisions like this to the sub-national health counterpart, national health counterpart, or even to the Ministry of Foreign Affairs. That focal point has been made quite early in this emergency. Number 3 is that there is a need for good monitoring and evaluation for the FMDs. That is a collaboration in this emergency collaboration of WHO, health cluster partners, and Ministry of Health. So there would be reports of what was going, was this foreign medical team performing well, was that foreign medical team not performing well, and so there would be and balance as the operations was. If a certain foreign medical team was not accepting patients for reasons that are unacceptable, then there is a way to convey the message that that is wrong practice. So this is pretty much takes a life of its own. It's a very big aspect of the health cluster. Next slide, please.
Jadi ada yang mau disampaikan, Bapak Ibu? Pertanyaan atau komentar? Presentasi Dr. Rodrigo.
ya, kalau nggak saya lihat tadi. Nah, based for decision maker on the basis of technical issues of FMT. Nah, ini kita melihat belajar dari pengalaman ketika gempa Jogja, itu banyak tenaga asing yang datang ke Indonesia. Mereka melakukan tindakan-tindakan bedah kepada pasien. Ketika periode tanggap darurat itu mereka masih ada di sana, tapi begitu tanggap darurat selesai mereka kembali, ternyata lukanya itu kan malah abses ya. Nah, bermasalah. Nah, kemudian dari aspek medical legal, ini tanggung jawab siapa? Apakah koordinator yang harus bertanggung jawab? Apakah si dokternya itu yang padahal dia sudah tidak ada di Indonesia lagi, dia sudah kembali ke negaranya, hingga jadi masalah bagi tim kesehatan di Indonesia, dan itu terjadi akhirnya malah dibedah ulang lagi oleh kawan-kawan dari dokter Indonesia. Terima kasih.
Yes, the question is there was a sample, there was a case before in earthquake in Jogja. It was a lot of surgeries.
I'm not hearing very. It's all choppy.
No. I will make it clear. Just
Okay.
give us a second.
Thank you.
Yes, and in Yogyakarta earthquake, there was a lot of foreign medical team come and do surgeries. But after the emergency period finished, so the physicians went back, and then there was a complication with the surgery. There was abscess. So the question is, who is responsible for that? The person who gives the permission to do, or the physician who are doing that?
Okay, Rodrigo. This is a question, specific questions. For instance, in any disaster, when the foreign medical team comes and then they carried out the surgery, and after they left, then they found some complications in those three managed cases. In this scenario, medical legally, who is considered responsible? Authority who have allowed them to come, or the foreign surgeon? So this is the question from our participant.
That's a very difficult question because all the medical legal laws and regulations are different per country, and in fact that might be a new policy to consider. What is the liability of medical team serving a humanitarian response? There have been, this has been an issue for so long, and this is why this effort for foreign medical teams to go up to standard and to register has been started and initiated, especially after Haiti, because there were many issues around that. Number two, this is also why we need to have a coordination between the foreign medical team and local medical teams. In some cases of the foreign medical teams that to Philippines during the typhoon, it was a mixed team. So for example, Indian Northern's Australian team had local nurses and some local surgeons, so that they would have continuity of care, but also clarity in the full management of the patient. Two, part of best practice for a foreign medical team is that if they cannot manage the case, it is for the health system to refer to a higher level tertiary care somewhere else in the country.
Participants of Foreign Affairs, Ministry of Foreign Affairs in South also. So what is the experience, past experience, let's say the example of IAN. The second question is, it's about the country offers the foreign medical team. Let's say Indonesia doesn't need that foreign medical team to respond for the disaster, but due to the good relationship among the countries, they need to accept it. So what is the experience I'm also sure that even in the high end, the Philippines government also overwhelmed with a lot of support from outside. How they manage? I think the question is in the same line. Did you get me?
Yes, thank you. Very good question, and I have a few examples. In terms of this issue of how to orient Ministry of Foreign Affairs, I think the best time to orient is when there is no disaster. But at the very least, if what has happened is that, you see, it was such a huge disaster that it took the whole of government to respond. So everyone has this way of being cooperative. There was a focal point, usually in the Philippines. It was the Bureau of International Health. So they have counterparts with the Ministry of Foreign Affairs. So they were liaising with the Ministry of Foreign Affairs. They informed them of the system of administration, requested for visa, open visa rules, setting up the one-stop shop in the when foreign people team arrives, easily move to the domestic area, go to the affected area. So there were things taken just by the offices of one ministry to the. So that really and as I said in my presentation, it has to be this openness when something like big as this happens. I think it's very difficult to say no. I think it was the second part of the question when there are good relations between two countries, especially when the country already opened itself to foreign assistance and foreign medical teams. There are two things. We have said no to some foreign medical teams. So there is a way to say no and say, please be on standby first, because right now we have foreign medical teams. This happened to countries such as Russia. So they were very, since we were keeping them informed and they were to listen on information, they set them on standby, and eventually they did that because they offered their assistance the 3.5 weeks into the event. So that was still managed pretty diplomatically. Two, you can, if there is no way of saving the ships, there were instances when the ships were already come. Then you have to limit the duration. You can also talk to the Ministry of Health and Foreign Affairs in the Philippines in close communication. Which part of the country they will be delivering service. Many people were thinking Tacloban because that was the most advertised or publicized in CNN. But there were other islands where this was needed more. So, for example, the UK ship, the ones with capability, we asked them to move to other islands. So, in essence, by 6 weeks, there were still around 8 foreign medical teams, and each was slowly phasing. So there was time to then plan what we needed next. Or was the country, the local health system ready to take the responsibility? So it's very good communication. That's one answer. Very clear. If you can say, if you already stated you don't need international assistance, that should be communicated to the Foreign Affairs Ministry, and the Foreign Affairs Ministry needs to communicate to all embassies. Most of the foreign medical teams in the first 2 weeks that came to Hainan were informed through the embassies in the different countries. Of course, still the issue will be. The difficult part is the private groups that come together.
Ada lagi mencapai atau cukup ini? Okay, Dr. Rodrigo, you hear me?
Yes.
Thank you very much for your cooperation, and thank you for your keep staying in your office until this time.
No problem.
Thank you and good evening.
Thank you very much again. Thank you. If you need anything else in the future, it's our pleasure to help and provide information ever just being that it was. Thank you very much and have a good evening. You're also staying.
Thank you. Baik Bapak Ibu sekalian, jadi demikian presentasi dari dua peserta besar terkait dengan FMT. Mungkin masih agak belum clear betul, tapi nanti ada pedoman yang mungkin bisa kita bagikan untuk dibaca-baca lagi dan diskusikan untuk beberapa hari ke depan. Terima kasih, selamat malam, assalamualaikum warahmatullahi wabarakatuh. Itu saya kembalikan ke Rata.
Para undangan sekalian, selesai sudah rangkaian acara workshop lintas batas dan lintas negara dalam rangka kesiapsiagaan penanggulangan krisis kesehatan pada hari ini. Besok pagi, acara akan dimulai kembali pukul 8. Pada hari ini dipersilakan untuk beristirahat. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Ini masalah itu loh, uji coba kita ke mereka nih, Pak.
Iya kan, Pak? Emang pakai bandwidth itu berbayar?
Mohon perhatian kepada Bapak Ibu semuanya untuk besok pagi di nomor 15
yang kalau cuma yang kita yang satu dua orang itu tahu gue enggak.